And good evening, and welcome to this edition of the Your Health is Important Facebook Live and Instagram Live presentation. I am Dr. MJ Collier, your host, producer, and on-air personality, and we're here to answer your healthcare questions. So you know the format. Welcome all of our new first-timers as well. This is the opportunity for you to call in and ask your healthcare questions, and we are ready at this time. All right, so today's topic is going to be several options. First thing I want to do is share with the ladies that are out there in the listening audience. There's a new product that is made to control the heavy bleeding, the heavy menstrual bleeding that's associated with fibroids when women have fibroids. Of course, we all know that uterine fibroids disproportionately affect women of color, and that basically almost half of women, up to 2/3 of them, suffer from fibroids, have a family member that suffers from fibroids. But the main problem, three things. One, pain, just abdominal pain and cramp and heavy menstrual flow, or crampy pain during your menstrual cycle called dysmenorrhea. That's painful menstrual flow. And then pain or discomfort when having intercourse. And then menorrhagia. Pain or comfort with intercourse is dyspareunia. Menorrhagia is the heavy bleeding associated with your menstrual cycle, and that is the most life-changing, disconcerting, etc. There are women who literally they had what they call in Atlanta the white pants initiative. In other words, you needed to be able to wear white pants, and you couldn't wear them if you were concerned about overflowing heavy menstrual flow, your pads not protecting you and covering you. And so the primary therapies up to this point had been: one, total hysterectomy, where they removed the uterus and the fibroids; myomectomy, where they just removed the fibroids; and then fibroid embolization, fibroid uterine embolization, or which is a non-invasive procedure performed by interventional radiologists. But now we actually have an option, an oral medication. There are two that were FDA approved in the last few weeks. And so these medications actually help control the bleeding and give you some great relief. If you can hang in there until you go to menopause, oftentimes the fibroids will shrink because they're no longer being fed by progesterone. And so when that happens, the fibroids will shrink and you will get resolution of that symptom. And so if oftentimes you can hang in there long enough, but there are cases of women that just bleeding, 20, 25 days a month, sometimes nonstop for month after month. And it's just life altering, life changing. You can't go anywhere. You're not comfortable traveling. You can't get in the swimming pool, and it's just your usual activities that you're used to. Intercourse is painful or avoid it because, again, you don't want to have intercourse while you're bleeding. So this is a problem. But this medication is one called Oriann, Oriahnn. It's an oral medication that you take, and it basically decreases the bleeding exponentially and can help tremendously with that. The problem is you can't keep taking it for an extended period of time. The original recommendation was that you would take it for up to 2 years. And one of the reasons was that because it can cause osteoporosis, softening of the bone, decreased mineralization of the bones. And so you have to monitor your bone density while taking this medication. So things that are out there and options that you can do. So great. That is the thing. If you want further information, just Google oral medications for heavy menstrual flow or heavy menstrual bleeding associated with fibroids, and it'll just pop right up and you can get more information. And you can talk to your OBGYN about this. Again, if you are having this problem and suffering from it, don't suffer in silence. There are now things that can be done. A lot of people thought the only thing they could do was get a hysterectomy, and they didn't want to get surgery, and they didn't want to lose their femininity, so to speak, by getting a hysterectomy. So they just lived with it. So now there are options for you out there. So let's get to my favorite topic, weight loss, Dr. Collier's weight loss journey. So I was recently had a physical, and they were really surprised at the amount of my weight loss. I told you I've lost 30 pounds. And so, of course, the first concern is that something's wrong, that you might have diabetes, which was oftentimes the first symptom is weight loss as the body catabolizes itself. It's literally eating its own fat and muscle to keep that high sugar level. And so that can be a problem. Or, something even worse, a cancer diagnosis is oftentimes associated with weight loss. So once the provider understood this was not the case, that we were just looking at a healthy weight loss because of the things that I share with you on a daily basis, the lipo drops, 1 dropper full under the tongue before each meal. During the aggressive weight loss phase, I do it 3 times per day. For maintenance, I'll do it once per day. That way, it alters the way that your body metabolizes food. So instead of storing fat, it allows you to metabolize the fat and utilize it as fuel. And once your body stops storing fat, it actually realizes that, hey, not only do I not need to store fat, I can let go of fat that I have already stored, and you just start to lose weight in inches. You lose that muffin top with the lipo drop. So again, great weight loss. I did do the more aggressive program using the Keto Max, 1 capsule twice daily as well, and then the lipo cleanse, which basically is a high fiber solution that allows you to keep eliminating. As you start to lose fat, and those things that are stored in the fat, they float around in your blood, and your body needs to detox. So detoxing with the lipo cleanse helps. You have large, easy to pass bowel movements that will keep your stomach flat, stop you from having a bloated belly, and also again remove those toxins. So things that other benefits that in addition to the loss of abdominal fat, the loss of fat under the chin, I've been told there's a more youthful appearance in the face because of the decreased fat. So I think that I'm very happy with the outcome utilizing those 3 things. And as you know, Dr. Collier's Trio for Good Health, I take these products every day. That's the omega-3 fish oil, which has a anti-inflammatory component to it. It's also good for cardiovascular health. It's good for joint health as well. The probiotics, which are good for metabolizing your food, establishing a positive biome in your gut of good bacteria. That means you digest your food better, you feel better, you don't have bubble gut after eating, and it helps with other allergy symptoms like itchy skin, itchy eyes, allergies like eczema skin, also improve markedly using the probiotics. And then the vitamin D, of course. Vitamin D, nature's own booster of the immune system, which makes your body an unfavorable environment for infectious pathogens, viruses, bacteria, and funguses. Your body's an unfavorable environment. They cannot live. They cannot survive. This is, again, the initial therapies that were implemented during the original COVID pandemic, when there was no other therapies. There was no vaccines. The only thing you could do was boost your immune system. There were other immune system boosters that were utilized, but the vitamin D far beyond anything else that was added to it. So we use that in creating and optimizing our immune status, but also strong bones, strong teeth, again, boosting the immune system, and then cancer prevention. Remember, the primary therapy that everybody, if you get a cancer diagnosis, before they give you anything else, radiation, chemotherapy, surgery, they're going to place you on vitamin D, because vitamin D is absolutely amazing when treating neoplastic growths, benign and malignant. But what they are recommending now, why wait until you have the cancer? Prevent the cancer from initially. The problem is that particularly when early evaluation of this was being done, they were using the FDA recommended very low doses of vitamin D, and they were not having an impact. Well, once you get to the therapeutic doses that do impact you positively, and that would be 5,000 international units of vitamin D3 per day. There are 2 stages of vitamin D. Vitamin D2, which is the inactive phase that you can take and your body metabolizes and changes and converts to vitamin D3, which is the active form and the one that you need and want in your body. Now, some people do that very efficiently. Some people don't do it well at all. And what happens is that if you don't convert D2 to D3 and you're taking a vitamin D2, then you're not going to benefit from it. You're not going to get any real increases in your serum D3 levels. But so cut out the middleman. Just take a very good vitamin D3 product that's already vitamin D3, and that will immediately boost your levels up. And again, but you need to take a therapeutic dose. The therapeutic dose of choice for Dr. Collier is the 5,000 international units per day. But I have seen new supplement regimens that give you 10,000 international units per day. The benefits of that, again, it's oftentimes in combination with vitamin K. So a combination of vitamin D3 at 10,000 international units and vitamin K is being utilized under some circumstances. But if you have any clotting disorders or if you're on blood thinners, you can't take the vitamin K. So do what Dr. Collier does. Take the vitamin D3 at the dose of 5,000 international units per day. Okay, Holly, let's do a roll call. Who's on the line? Okay, so who do we have here? Okay, Sean Big Time Green. Good evening, Sean. So glad to see you, my friend. Angela Merritt from St. Louis. Thank you. St. Louis is in the house, the Midwest. Okay, Mimi Witcher. Good evening, Mimi. How are you? This is a pleasant surprise. Mimi's in Tampa, Florida. Rachel Harrison. Good evening, everyone. So good to see you as well. Thomasine Morris. Good evening, Thomasine. You didn't tell me where you're from. Makiba Boland from Douglasville. Great job, Ms. Boland. Thank you so much for being a watcher, a listener that I can count on. You're here at every Facebook Live presentation. Barbara Jones, hello everyone. So good to see you. Hi, Regina Fletcher from Atlanta. So glad to have you in the house. I follow you on Facebook. You are amazing. Venus Black, hello from Rockford, Illinois. Thank you, Venus. We're so glad to have you here. Mo White, good evening from Mississippi. Thank you, Mo. We appreciate you for being here with us this evening. Carlos Ward, Carlos, all right, we got a fella in the house. Hope, Carlos, that you are taking that lipo T. It's life-changing. It's life-changing. Lenita Rose from Arkansas. Okay, now we got it. We're north, south, east, and west. Columbia, South Carolina. Anita Super. Hi, Anita. You are regular. We're so glad to have you back again. Okay. Don Crenshaw Bustle from Indiana. Hi, Don. Thank you so much for being here with us this evening. Okay, very good. Thank you so very much, Heidi. Let's get to some of the questions. Victoria Pleasant Wallace from Monero, Louisiana, one of my favorite states. Of course, best food in the house. Champ Brown from Charlotte, North Carolina. Thank you, Champ. Julian, we're there. Okay, let's get to your questions. We'll do another roll call as well because we want to know who you are and where you're from. Angela Smith. Good evening, doctor. I want to know how to decrease your creatinine. My husband had a liver transplant and he needs to get it down to a 1 instead of a 2. Okay, the creatinine is an evaluation of, is one of the things that evaluates your kidney function. There are 3 tests: the blood urea nitrogen, the creatinine, and the glomerular filtration rate, or GFR. The GFR should be 60 or higher, the BUN between less than 20, and the creatinine in a lot of places, again, you want to be 1. I think 1.2 is actually normal. So we want to get it down less than 2. The number one thing that your husband can do, 1, control his blood pressure. Number 2, if he's diabetic, control his blood sugar, because an elevated creatinine is an indication that damage is being done to your kidneys, usually by a metabolic process like high blood pressure or diabetes. With high blood pressure, it's more of a physical phenomenon. Every time your heartbeat is punching, 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 and your kidneys are nothing basically but filters. And so those filters are just like screen doors at grandmama's house back in the day before air conditioning. You would open up the hard door and the screen door would let air in and keep the bugs out. But some bad little kid would always take a pencil and punch a hole in the screen. Now bugs can get in and out. And so this was a problem. And that's literally what's going on with the kidneys. The heartbeat is punching the filter that is the screen door in the kidneys. And now protein molecules are getting out that normally are not, they're filtered through the kidneys but remain in your bloodstream, but now you're leaking them. So you get a sign or a symptom called proteinuria, where you have protein that's detectable in your urine when you're tested. So controlling the blood pressure, controlling the blood sugar, and drinking lots and lots of water. That is the biggest problem, particularly with a low glomerular filtration rate. The glomerular filtration rate is literally how effectively your kidneys are filtering your blood, which is the fluid. If you don't have a lot of fluid, it can't filter. So you get a low filtering rate or glomerular filtration rate. So pushing that water. Everybody thinks they drink a lot of water. Nobody does. 8 to 10 glasses of water per day are just maintenance. And so he needs to drink lots of water. And ideally, while we're trying to get that creatinine down, that would basically be the liquid. I wouldn't drink anything else. No coffee, no tea, no juice, no sodas.
nothing like that. Just water and lots of it, and that will hopefully help improve the renal function. But those three things: control the metabolic diseases like high blood pressure and diabetes, and drink lots of water. Now, this is not an instant process. He's going to have to do this for a while, weeks, possibly months, before he sees the benefits of it. But there will be benefit. The kidneys are one of the organs in the body, the liver being the other, that can regenerate itself if given the opportunity to. It can literally repair itself and create new cells. So those are two things that can happen. Sometimes you're past that point. If your husband is needing a liver transplant, his liver may already be beyond regeneration. But again, they're not going to transplant if his kidneys are not functioning in an appropriate manner. So great question, Angus. Thank you so much for reaching out, and let us know how he does. Okay, Crafty Cover. Does omega fish oil will make women smell like fish? It will make men smell like fish as well. And any body fluid that you secrete if you have a non-pure omega-3 fish oil product. One of the things that you can do when you're looking at your omega-3 fish oil is to open the bottle and smell it. If it smells fishy, it is not a purified product. If you pick the capsule up and look through it, it's always a capsule. It should be crystal clear. If you cannot see it, or if it's cloudy, or if you bring it to your nose and it smells bad, then you're going to have some problems smelling like fish. Now, the therapeutic dose of omega-3 fish oil is between 3,000 and 4,000 milligram dosage per day. Most capsules are 1,000 milligrams. You take 1,000 milligrams, that would be 4 a day. You take 4 a day, you're going to smell fishy, even with the best of products. Our product is 1,480 milligrams, and you take our Lipo Omega, one capsule in the morning, one capsule in the evening. You can take 2 capsules in the evening together or with food. It's better absorbed with food. You don't have to take it with food, but you will see that this product is pure. When you open the bottle, there's not even a hint of fish smell in there. And when you look through the capsule, it is crystal clear. So that lets you know that you have a highly purified omega-3 product. Remember, the best omega-3 fish oil comes from fish that are bottom feeders. So if they come from the lake, they're eating whatever on the bottom of the lake, everything that sinks to the bottom of the lake. And that's all the toxins, all the garbage, all the excrement, everything that's on the bottom of the lake, they eat it. And if they eat it and it's not removed from them, because the simple process is basically like taking a fish and putting it in a blender and just getting the oil out and pouring it off. Well, that's the lowest level of acquisition of fish oil. When it's filtered, again, it should be crystal clear and the fish smell is removed. So that answers the question, Captain. So just order our Lipo Omega and you won't have to worry about that problem. Sandra Moore. Hi, Sandra. How are you? Is there something you can recommend to treat hyperpigmentation on the face, which causes an uneven complexion and the dark circles under your eyes? Sandra, I tell you, I have been introduced to a company that specializes in just that, products for women of color. Because oftentimes, a lot of the products that have been available to lighten the skin were for majority women, Caucasian women. And if a black woman used these products, it would cause uneven skin and would lighten or depigment the skin, which was appropriate for them, but not appropriate for a woman of color, an African-American female. But this company specializes. I understand that the founder is a scientist who suffered from this herself, and she has a line of products. It's a 3-stage process that hydrates the skin, makes the skin healthy, and lightens and those uneven tones, and really gives you a great skin glow, basically. So we're going to have a whole show about that, because that is a great topic, Sandra. So we want to make sure that we get that topic going. The name of the company is Visibly Beautiful Skincare. Visibly Beautiful Skincare. You can go to their website, visiblybeautifulskincare.com, and find out about their 3-stage process for giving you the beautiful skin. And we're going to have this vehicle. We're going to bring it to the attention of our listeners, the people that tuned in for our Facebook Live, because this is one of those issues that I literally have somebody ask me about this on a daily basis. And for this is ladies and men too. Men, you get those dark circles on your eyes, depending upon Dr. Collier's state of hydration, how much fatigue he's had, he'll get the dark circles under the eyes too. And so these products, I'm looking forward to seeing if this will enhance that, and also some of the puffiness under the eyes that can go along with that. So, Ms. Moore, we will greatly appreciate that question. Go to the website, visiblybeautifulskincare.com, and find out about the 3-stage process to even out those patchy areas, blend the skin that it's all the same color, lighten those dark spots without over lightening, without creating permanent hypopigmentation. So we're dealing with hyperpigmentation, where the skin gets too dark in certain areas. We want to blend that in. So great question. Thank you so much for tuning in. We hope you become a regular as well. Okay. Full-time mama, can you give vitamin D to children? Yes, you can. And it is one of the things in a lot of comprehensive vitamins, complete multiple vitamins with iron and minerals. There are several brands for children that are chewable, that have some vitamin D in there. The question is, what's the dose? And we're talking about the age of the child. So this is a situation where 300, 400, 500 may be more than enough. Children also get more outdoor activities. And so if they're outside in the sun, they're going to also make some vitamin D naturally from doing that. It's us adults that don't get any sun exposure. Maybe when we're on vacation, but routinely we're leaving home before it's light. We're coming home after it's dark. We stay in our office space all day. We don't get any sun exposure. And so, again, but understand this, people that do get sun exposure, for whatever reason, there's something in our environment, something in our food chain, something. Don't know what the origin or the etiology is, but vitamin D deficiency is a major problem with us now. Everybody, 9 out of 10 people that I test not only have low vitamin D, but they have very low vitamin D levels. Somewhat, I don't even know. I said, I don't understand how your bones aren't breaking with every step that you take, because when your vitamin D is below 10, you have weak bones, you have weak teeth, and that is when you get gum disease, and your teeth will literally be loose and can just fall out, or you bite into a piece of food and you've lost that tooth. Not counting when the enamel on your teeth is weak, you end up with dental decay. So all of this can be big problems for you in doing so. So we want to make sure that our children are getting adequate amounts of vitamin D. You can consult with a pediatrician, but if it's a child that's, say 10 to 12 years old, as much as children weigh these days, I can state without question, they can take a vitamin D dose of 1,000 milligrams with no problems at all, if they can swallow pills. If not, there are gummy versions now of vitamin, virtually anything you want in gummy version now that you can do that with. So great question, full-time mama. Pat Jones, my cholesterol is high at 210. My calcium levels are elevated. I exercise and try to eat healthy. What can I do to take care of this? Pat, the normal level for cholesterol is less than 200. So I'm glad that you stated that your cholesterol is high at 210, because the argument that most people present to Dr. Collier is they say, oh, it's elevated, but it's not too high, or it's high, but it's not too high. Well, the problem is that it's like being a little bit pregnant. Either you meet the criteria or you don't. If you meet the criteria, that means 201 and higher, then that means you're at higher risk for a cardiovascular event, that event being a heart attack or a stroke. You want to make sure that you are getting that cholesterol down. But you want to know more than just your total cholesterol. You want to know the breakdown. What is the HDL? The HDL is the high density lipoprotein, or good cholesterol. That number should be 40 or higher. The higher that number is, the better. So see, if you have a total cholesterol of 210, but your HDL, the good cholesterol, is 50 or higher, that for all practical purposes kind of cancels that out. If your LDL, the low density lipoprotein, which should be 100 or less, that is the bad cholesterol. That is the one that makes you have a heart attack or a stroke. The HDL protects you from having a heart attack or a stroke, the good cholesterol. So you want to make sure that all of those, and the fourth component of a lipid panel is your serum triglyceride levels. So your triglycerides should be less than 150 in a fasting state. After eating, your triglycerides may go up to 300 or 400, but they will always come down if your triglyceride level is normal in a very short period of time, called the postprandial phase, or after eating. But for fasting triglycerides, that number should be less than 150. Now, people say, well, I'm going to get my cholesterol tested. Should I fast? You can, but you don't have to, because your cholesterol is not going to vary 1%, regardless of whether you're fasting or not. But your triglycerides will vary substantively and significantly in your fasting and non-fasting states. So if you have a random cholesterol that's 210, then your cholesterol is too high. And I'm glad that you challenge. You want to do something about it. One, you want to minimize the amount of saturated fat that's in your diet. Your preferred method of food preparation is baked or broiled, not fried. So if you have a choice of a baked or broiled option, a baked chicken versus fried chicken, a baked potato instead of French fries, those are just simple things that you can do to help get it down. Omega-3 fish oil is the perfect supplement for cholesterol like this. It's only 210. Omega-3 fish oil will lower the total cholesterol, increase the ratio of the HDL, decrease the ratio of the LDL or the bad cholesterol, and lower your triglycerides. Everything literally that you want to have in your lipid panel, omega-3 fish oil supplementation will help with, particularly with the elevated triglycerides. So you have to be, that will be something simple that you can do. There are other supplements that you can take. Everybody knows about red yeast rice. Red yeast rice is basically a pre-statin. It's converted to a statin, which is the medication that you use to lower your cholesterol. And there are three main statin class drugs. There's Crestor or rosuvastatin, there's Lipitor or atorvastatin, and there's Zocor or simvastatin. There are two or three others, but those are the main three that most people are options that are given by the doctors. And if your objective is to get it down quickly, then take a statin class drug. Oftentimes patients will ask me, they'll say, Dr. Collier, I don't want to take a medicine. Isn't that something I can do naturally? Well, the two things I just mentioned, the omega-3 fish oil and the red yeast rice. But if what my comeback to that is, take the medication, push your cholesterol really far down, and then maybe you can come off the medication and see if we can sustain and or maintain good cholesterol levels by diet and supplements like the omega-3 fish oil. So go to the website, lipodrops.com, get the omega-3 fish oil, the Lipo Omega, one capsule twice daily will get that cholesterol total down, increase the HDL, the good cholesterol, lower the LDL, the bad cholesterol, and lower the triglycerides. Also, so many other benefits from omega-3 fish oil with joints. It's just a generally good anti-inflammatory and improves and decreases your cardiovascular risk for a cardiovascular event, those events being heart attacks or strokes. Great question. Okay, Sandy Smith. How and what do I eat while taking the lipo drop? Should I exercise every day? Sandy, you can exercise, but exercise is an adjuvant thing to do for weight loss. You do not lose weight in the gym. You lose weight in the kitchen. Exercising and going to the gym will help you get fit. It will help increase your metabolism, and you'll feel better. You'll probably look better because you have muscle definition, etc. But you're not going to get a substantive amount of weight loss from going to the gym. A very good, vigorous workout for an hour, which is the amount of time that most people have for working out, 1 hour, burns 800 calories. The amount of calories that you have to burn to lose 1 pound is 3,500 calories. So that is why when they tell you to decrease your caloric intake or burn more calories up to 500 calories per day, less or burning 500, after 7 days, that's 3,500, you lose 1 pound a week. That is the basis for virtually every weight loss program that has existed for the last 50 years. Well, we learned a little something. Decreasing your caloric intake, one, always works. You will lose weight. The problem is, as soon as you go back to your regular diet, you gain all the weight back. And so the objective is not to restrict your calories and make your body lose weight. The objective is to alter your metabolism and allow your body to more efficiently metabolize the foods that you do take in, which is the whole basis of the intermittent fasting and the 5 meal per day meal plan that comes along with the lipo drops. So lipo drops you would take, again, for slow weight loss, 1 drop of food 1 time per day. For increasing your rate of weight loss, 1 drop of food under your tongue for 2 minutes before each meal, about 15 minutes before each meal. And then I recommend for you, Sandy, intermittent fasting. That means you eat everything that you're going to eat within 1 8-hour period every day. That 8-hour period for most people, 10 to 6. That works out for the vast majority of people, but it can be 8 to 4. It can be whatever period works for you. 1, drink lots of water so that you're flushing your body out and also staying hydrated. and 2, do not eat outside of that window. What we have found is that people always ask, well, what should I eat? It's really not as important what you eat, is when you eat it. The effectiveness and the benefit from intermittent fasting is not directly related to what you're eating. Of course, you can't eat donuts and drink sodas all day. That would, in doing an 8-hour period, that's not the spirit of what we're talking about. If most people actually eat reasonably decently, but they either can't gain weight or can't lose weight, or they gain weight from doing so. And the problem is the metabolic process in their body that has to be altered. And that is what we're talking about now. So that's what you should do. The intermittent fasting, eat everything that you're going to eat within one 8-hour period. Take the lipo drops, 1 drop of food. It always measures exactly 1 meal. When you squeeze the bulb, put it under your tongue, hold it under your tongue for 2 minutes, then swallow it. It works under your tongue. What you swallow doesn't give you any benefit. It's what's absorbed under the tongue. It's exactly like taking an injection, which is why we came up with the lipo drop product. The injections that we give in the weight loss center are called lipo-bite, but the lipo drops are basically almost the exact same combination of medicines, but it's absorbed as efficiently under the tongue as if you had gotten an injection in the doctor's office. Great question, Sandy. Joyce Bethel, all right. I got bit by a tick 2 months ago and that spot still itch. Why is that? I had the Lyme disease test done. Okay, so your body, basically the proteins from the tick are within your skin, and your body is not recognizing them as you and recognizes them as self, not recognizes them as self or you, and recognizes them as foreign proteins, and it attacks those, and it causes an allergic reaction, which the most common symptom is pruritus. It can also be itchy, it can be dry, it can be scaly, but the most common is pruritus, which means that it itches. A standard steroid cream, 1% hydrocortisone cream that you can buy at the store where everything is $1.25 now. And it's just very effective. It's the exact same one that you buy in the bigger box of drugstores for $20 a tube. The exact same stuff, $1.25, and that will give you a great relief. If it's not red, if there's no if it's not tender to the touch, if there's no drainage or pus coming from it, then it's not infected. It's just strictly basically an allergic phenomenon. You can also take an oral non-sedating antihistamine. The one that works best with skin issues is Allegra or fexofenadine. The dose is 100 milligram tablets, 1 tablet 1 time per day. You do that and you apply the hydrocortisone cream, and that'll control the symptoms. The symptoms will go away once your skin has literally turned over and that those proteins have been removed. That process may take a few weeks. As you said, it's been 2 months ago and you still have the issue. So it may be, particularly if it's formed granulation around it, then it's holding those proteins, and that's where the steroid will come in to help that. So a simple and elegant thing that you can do, keep the area clean, wash it with an antibacterial soap like Dial or Lever 2000. Then you can use witch hazel as an astringent on that spot on a cotton ball. Just wipe it off with witch hazel, let it air dry, then put the steroid cream on there, and that should tighten that up, Joyce. Great question. Okay, Sandra Pope Lamar, can I explain vertigo? Yes, I can. Vertigo is when there are 2 types, basically, when either you feel like that you are spinning or that you're sitting still and you feel like the room is spinning. In your ear, there's the outer ear, the ear canal, the middle ear, which is the hearing center, and the inner ear, which is your balance center. When your balance center, and when either your middle ear has too much pressure in it or negatively impacted in some way, it can be barometric pressure changes, i.e. it's going to rain, or we're having some violent weather symptoms. I've had multiple cases of vertigo in the last week in the city of Atlanta because of all these weird weather patterns that we've had. It's affecting people anytime and any place in your body where you have a closed space with fluid in it, like your knees, like your joints, like your inner ears. When the barometric pressure rises, pressure inside those areas rise. The middle ear, that fluid, the purpose of which is to provide lubrication to the 3 bones of hearing, the incus, the malleus, and the stapes. Those 3 bones, they vibrate, they go to the eardrum vibrates, those 3 bones vibrate, and then your body and the neurons in your middle ear recognize this and makes sound. It's interpreted as sound. Well, in the inner ear, there are cochlear that are at two angles. At three angles. One is straight up, one's about 45 degrees, and one is at 90 degrees. So those three cochlea, their fluid field as well, and they have inside of them little hairy projections called cilia that orientate you. So that's why you can sit and close your eyes and you know exactly what your body's position is. Whether you're standing, whether you're sitting, you have an innate awareness of that because of that center, that balance center. Well, if there's something that happens to that balance center, you get that sensation of dizziness. You can get it, you can activate it by just spinning around. If you've done that, and you stop, and then all of a sudden you feel a little woozy like that. Well, imagine that phenomena is happening because of changes in the atmospheric pressure. It can be caused by infection in the middle or inner ear, inflammation caused by a variety of different issues, or as we age, arthritis changes in the three bones of hearing: the incus, the malleus, the hammer, and the stapes, the stirrup. The anvil, the stirrup, and the anvil, the stirrup, and the hammer. So those three things create that problem. So it is literally that people with chronic vertigo, they really get no relief from a variety of different things. But most people do get relief from a combination of things. I usually give people an anti-inflammatory steroid injection, or either oral. I give them a non-sedating antihistamine such as Allegra, Claritin, Zyrtec, or Xyzal, a nasal spray such as Nasacort or Flonase, and a mucolytic such as Mucinex at maximum strength. All of those things you take to keep the fluid inside the middle ear thin and watery, because if it gets thick like glue, you're going to be suffering. So you thin the fluid out with the Mucinex, the mucolytic, the antihistamine to decrease the production of fluid so you don't have excess fluid in there. The anti-inflammatory in case it has inflammation, and sometimes an antibiotic. If a person tells me that when they blow their nose, that the mucus is not clear, it should be clear. It may be tinged like yellow, but it should be clear or white. If it's green or brown, then that's an indication usually of a different type of bacterial infection, and so you need antibiotics as well. There's a drug that treats the symptom called Antivert or meclizine that works wonderfully in most people. It gives you symptomatic relief, and you take it when you're feeling that way. I tell my patients, take it nonstop. Basically, it's one pill every 8 hours. Take it for 2 weeks so that your body can reestablish normalcy and you don't have that sensation of dizziness or vertigo. Versus just taking it when you feel like it, because you'll be batting it back and forth and going back and forth and feeling good in position. You move your head too abruptly and all of a sudden you're dizzy again. You bend down to tie your shoes and you're dizzy again. You get up too quickly from the bed after laying down, that fluid collects on one side or the other of your head, and then you sit up, you have disbalance, discordance, and vertigo. So it's a easy symptom and diagnosis to make, but treating it can be difficult and challenging. But it can be treated, and again, you don't have to suffer from it. If none of those things work, I refer my patients to an ear, nose, and throat specialist, because sometimes they can do decompression procedures that will balance that fluid balance in the inner ear and the cochlea and restore you to a state of normalcy. Okay, great question. Barbara Fan, good evening. I'm a first timer, will follow you for a while and love your sessions. Thank you so much. We appreciate you. What do I think about the health benefits of cayenne pepper? Cayenne pepper and multiple other hot peppers, red peppers, cayenne peppers in the red pepper group. Red peppers have been shown, one, they're anti-inflammatory. They have immune function benefits, and they stimulate your body in a variety of different ways. So a lot of therapies will include that. Turmeric is basically a pepper, a powder that's anti-inflammatory in nature. So there are curcumin is another one. So cayenne is one of the components of cayenne that gives you that benefit. And again, I tell patients, one, you can eat it. You can, some people just sprinkle it on their food like a condiment. Others, there are cayenne pepper capsules that you can take. There's powders, there's teas, there's all kind of various formulations. But the bottom line is that these types of supplements do work and provide a lot of benefit for a lot of people, from everything from joint pain, inflammation, to just overall just a sense of well-being. You just feel better. Some people do when they take those. They can curb your appetite and result in weight loss as well. So the Dr. Collier gives 2 thumbs up to cayenne pepper and those things like it.
Okay. Food Georgia girl, almost 40 and suffering from varicose veins in my leg. It's not only an aesthetic problem, but also hurts really bad, particularly during my monthly time. What is that? It can be done. There's an entire network of clinics called Vein Clinics of America. And with what you've just described, it sounds like you have what's called reflux in your veins. Your veins, unlike your arteries, have valves in them. Your arteries don't have valves. Blood usually flows one way because of the pressure behind the blood from your heart. Each time your heart beats, blood moves forward. It moves like this in a linear fashion. Well, when you get to the other side, we're returning blood back to the heart. There's no pulsatile action for that. Pardon me. There's no pulsatile action for that. So the way that your body keeps the blood moving forward back toward the heart is by valves that are in each vein. Where if those valves don't close appropriately and they open up and they have gaps, then you have blood flow going backwards and forward. That dilates the vein and it stretches, and now you have incompetence of those valves. That can be determined by ultrasonography and amongst other testing. There are a couple of other things that can determine that as well. But that is a medical diagnosis that will get your insurance to pay for you getting these varicose veins removed. If you don't, you should qualify based on that. But some people just want it done. They don't have the reverse flow. They don't have the valvular issues. They just don't like the blue veins that they have on their legs. And they can correct those by various techniques. One is the main technique is sclerosis. Sclerosis can be accomplished in a variety of different ways. The most common is a hypertonic solution, a very salty solution that burns the inside of the veins. They wrap the veins up so that they stick together, and when it heals, it's closed, and blood flow does not go there. There are lots of extra pathways for your blood to flow, so it doesn't compromise your circulation, but it takes away those the small ones are spider veins. The larger ones are just big blue venues of dirt that most women don't care for at all, and so you want to make sure that's not a problem. Controlling your weight helps tremendously with that as well, and wearing support stockings or men's support socks. There's literally no difference in men's socks and women's socks, except women's socks cost more and don't last as long. So you can buy men's over the calf support socks, and they will give you a lot of benefit for your lower legs so that they compress the veins so that there's no space for the fluid in the blood to collect and backflow. And so it stops them from dilating, and that will help tremendously as well. And we're not talking about the light brown stockings that you see, the compression stockings. We're talking about support stockings. Compression is a whole different issue, but support will do just that, give you support. Again, they're not unappealing physically. They come in every color you can imagine, so they match any outfit that you have, and you want to make sure that you are protecting yourself. If you're on your feet all day, like Dr. Collier is, I wear over-the-calf support socks every day, and I know that it has made a major difference. I don't have fat ankles. I don't have swelling, don't have varicose veins, knock on wood, because of that preventive technique that we utilize. So you can use that too, Food Georgia girl. All right. Cedric Keys, what product can I use to sleep good at night? Cedric, there are many. The most common is melatonin, which is available over the counter. It is not a sleep medication, but it is replacing the hormone that your body needs to allow it to sleep effectively. The other thing is good sleep, a good sleep environment, good sleep hygiene. That means a dark room. That means a quiet room. That means a cool room. So oftentimes, me and Mrs. Collier are fighting over the temperature of the room and how many blankets are going to be on the bed. Because if you get too hot, you cannot sleep. So you need cool comfort. You need a quiet room. You can't have, the vast majority of people cannot have background music, background noise. All of those things are distracting, and keep your brain at minimally at an alert level that does not allow you to have deep restorative sleep. You have to enter REM sleep, which is the stage of sleep in which you're dreaming, to get restorative sleep, the one you benefit from. Otherwise, you're just laying there. You might even be asleep, but you're not restoring yourself. You're not resting. You're just sleeping, and you want restorative sleep. That cycle is at least 3 hours long. And let's say you have to get up and go to the bathroom multiple times. You break that cycle, and even though you may get up, use the bathroom, be able to go back to sleep,
then you're no longer in REM sleep, so you're not resting. So you wake up tired. You wake up, I've been to sleep all night and I don't feel rested. That's exactly what happens. Not counting other issues like obstructive sleep apnea or other things that can interrupt a good night's sleep. So melatonin, a good supplement, Benadryl or anything with Benadryl in it. All of your PM preparations, Advil PM, Tylenol PM, they're basically the parent product, Advil or ibuprofen at a 200 milligram dose plus 25 milligrams of Benadryl. You take 2 of those and you should be able to get a good night's sleep, one that stops pain, inflammation, joint pain, etc. But also 50 milligrams of Benadryl is a strong enough dose to make you sleepy, but not so overwhelming that you're going to have daytime sleepiness the next day. Your body will metabolize and have that medication totally used in about 6 hours. So you have to have that much time. If you waited to 4 a.m. to take a sleeping pill and you got to get up at 6, you're going to have a negative impact. It's going to make you sleepy during the daytime, or you're going to sleep through your alarm. So the decision to decide whether to take a sleep aid should be made about 10, 11 o'clock that night before, depending upon what time you have to get up. But the universal wake up time is 6:30 a.m. So if you've taken the medicine by 11, last 46 hours, it's out of your system. You should wake up no problem in the morning. Should not have any residual results from it, but you should be able to get a good night's sleep. I tell my patients, try doing that for a couple of weeks, see how you do. And if you don't do well with that, then we might give you a prescription strength sleep aid also. Okay, great question, Cedric. Damon Duherd, how to heal testicle varicose and atrophy naturally without surgery. You cannot. It is a surgical problem. The varicoses in the testicles are the same as the varicose veins in your legs. They are dilated veins. You cannot, you can wear like a jock strap to support your testicles and give some support, but this is a surgical problem. And if you have large varicoses in the testicles, it effectively sterilizes you because it immobilizes your sperm cells and it decreases the production of sperm cells. So it makes you naturally sterile, which some people love. Other people want to have children, want to make sure that their peanut butter is chunky, not smooth. And so they want to make sure that there's no problem with that. So unfortunately, Damon, this is a surgical problem, and that's the way that you can do it. No natural way to fix that phenomenon, unfortunately. Okay, great question. Carlos Ward, good evening. I sometimes experience swollen legs. How can I treat and prevent this? Carlos, a variety of things. Once again, if you're on your feet all day, over the calf men's support socks. 2, monitor your salt intake because a high intake of sodium, and a lot of people, they don't even think about it. They snack on peanuts that are salted, or popcorn that's salted, or potato chips that are salted, and then that salt makes your body retain the fluids. When you're standing, walking, etc., the fluid by gravity gravitates to your legs, and you have swollen legs, feet, and ankles. And there's not ever a good time to have fat ankles. You don't want to do that. Once you've stretched that spongy tissue around the ankle out, it will not shrink. It won't go back to its normal state. It may get better overnight. And if you're in a situation like most people are, you have swollen legs by the end of the day. You lay down, go to sleep, and when you wake up in the morning, your ankles are skinny again. That means you don't have a real circulatory problem. Your problem is gravity. And so you need to make sure that you're not creating a space for that fluid to collect in your legs, which is why you want to wear the over-the-calf support socks, over-the-calf support socks. If the fluid is building up above your knees, you need to be evaluated for some other issues that can do that, because most of the time the fluid accumulates in your feet and ankles, possibly your lower legs below the knee. But if it comes above the knee, there's something else going on. It may require you may have uncontrolled high blood pressure. You may need to take a diuretic or a water pill to remove that excess fluid. Amazingly enough, one of the things that happens when people don't drink enough water is that their body retains fluid and they start to appear swollen. And they say, well, I'm swollen already, so I'm not going to drink water. Yes, you drink water, you lose the excess water, and you diurese. You're urinating all of the time, and that's one of the simple ways. So make sure that your water intake is also adequate, Carlos. Great question. Okay, Tamika Parrish, I'm having a major problem with inflammation. I would like to know what can help with it. Tamika, you are wonderful. Again, Dr. Collier's 2 favorite natural anti-inflammatories, vitamin D3 at a therapeutic dose of 5,000 international units per day. One tablet, one time per day. Our Doctor's D vitamin D that's available on our website, lipodrops.com. Go to lipodrops.com. Get the vitamin D, 5,000 international units per day, a great anti-inflammatory. Also, omega-3 fish oil. Omega-3 fish oil has a variety of good anti-inflammatory components. It protects your cardiovascular system, preventing heart attacks, strokes, disease states like diabetes or inflammatory conditions. Being overweight is an inflammatory condition. It doesn't mean you don't have to be morbidly obese. You don't even have to be thick. You just have that extra 20, 30 pounds that most people have, and you'll see that this is a problem, that you're going to you have inflammation and you need anti-inflammatory. So Tamika, the omega-3 fish oil at the dose, one capsule twice daily, and the vitamin D, both available at the LipoDrops website, will be life-changing. Those are two of the things that Dr. Collier recommends that everybody on this planet take on a daily basis. The only other thing, the third component of Dr. Collier's trio for good health, is probiotics. You get the trio for good health pack that contains those three things, and you will see that the inflammation will be totally, if not totally eradicated, much improved without question. Great question. Deborah Mathis, should thyroid nodules be removed if they are overactive? Yes, they should, because they're not going to become less active. They can be responsible for a condition called thyroid storm. There are oral medications of two types, one that blocks thyroid hormone production, the other that just fixes or controls the symptoms. That's the beta blocker class drugs. The drug that we're talking about is propylthyroid uracil is the main one. There are three, but propylthyroid uracil stops the effect of the thyroid hormone, the production of the thyroid hormone, and the beta blocker class drugs stops your body responses to excess thyroid. But you are basically just trying to control the problem. You're not fixing or correcting the problem. So if you have thyroid nodules that are overactive, and that's a key component that you just stated, you can have thyroid nodules that are just nodular and they're just there. The thyroid, again, is a butterfly-shaped gland. It's, if you reach here, right over, this is your trachea, and right on the front of the trachea is a butterfly-shaped, two wings go this way, two wings go this way, and those nodules that you can get in there are oftentimes benign. They're non-cancerous, and they're also not hormone emitting. But if you also have been diagnosed with overactive thyroid, that's what you have to do. And the surgical procedure can be just removing the nodules, or removing a half of your thyroid, or a third of your thyroid, or removing the entire thyroid. A partial thyroidectomy will oftentimes result in you still making natural thyroid, and you don't need to take thyroid supplements. A total thyroidectomy is going to require you to take thyroid supplements, because you will go from being hyperthyroid to euthyroid or hypothyroid due to the surgical procedure, and you're going to need thyroid hormones from that point for the rest of your life. But if that is there's no alternative. If your thyroid is just overacting and inflamed and you have to have it removed, you're going to have to do that. Okay, great question. LaDonna Holly, good evening from Baltimore. Very good. What are the signs, symptoms of carpal tunnel syndrome? The best symptom of carpal tunnel syndrome is usually it's in the dominant hand. So if you're right-handed, your right hand, left-handed, the left hand. And the signs or symptoms, the pain, the discomfort, the shooting, it can be pins and needles. It can be numbness. It can be as if your hand is on fire. It can be all of those things. It can be none of those things. But the most important description is this. I ask people, do they feel like the problem is starting in their hand and moving up their arm, or do they feel like the problem is in their arm and moving down to their hand? If it's in the arm and moving down to the hand, that's probably not carpal tunnel. There's other things that it could be. But if it's in the hand and you feel like it's moving up your arm, that's carpal tunnel until proven otherwise. But you don't have to guess. There are certain diagnostic tests so that they can just basically shoot electrical impulses up and down your arm and then make that evaluation to see. The simple things that you can do for carpal tunnel are anti-inflammatory medications. Again, vitamin D, omega-3 fish oil, Motrin, Advil, Aleve, meloxicam, or Mobic, Sexavir or Celebrex. All these are good things you can do, but more importantly, the carpal tunnel is here in your hand. And the thing about your carpal tunnel is this: in that tunnel is where nerves, arteries, and veins, and all the tendons for your hand are all piled together in a special space. As long as everybody keeps in their territory and there's no overwhelming of the space, then you're fine. But if you get injury to the hand, swelling, edema, it compromises usually the nerves. They're the most sensitive to small changes in pressure, and that is why you start to get those symptoms. These two fingers, the fourth and the fifth finger, are stimulated by the ulnar nerve. These three fingers, the middle finger, the thumb, and the index finger, are stimulated by the medial nerve. And so depending upon, you can make that diagnosis based strictly on that. A person will say with my hand, but then when you actually get deeper into it, they'll say, no, it's really these three fingers or these two fingers. And then you'll know whether it's the radial nerve or the ulnar nerve or how to do it. But you open up the carpal tunnel by bending your wrist. When we're working on the keyboard, we turn our wrist down like this, and that compromises the carpal tunnel. The relaxed posture of the wrist is here with your arm and your hand up about 15 to 30 degrees. There are braces that fit under here. They have a metal spoon that holds your wrist in that relaxed position. You put it on like a glove, but your fingers are free. It can stop midway up your wrist. You can stop halfway up your forearm. You can buy them at any drugstore that has durable medical equipment or DME. Have them fit one for you, because oftentimes ladies are somewhere between a medium and a large, and so you want one that fits appropriately. But a Velcro straps, a metal spoon, wear that, see if that gives you some relief. Ultimately, if none of that works, or if it stops working over time, then the procedure is surgical. They go in and basically scrape out all the extra stuff, and so there's more room in the carpal tunnel. But fortunately now, they used to literally take a scalpel blade and split your hand open, and the heal time and recovery time was extensive. Now they can literally use a laser-like thing that is thinner than the inside of an ink pen, thinner than the inside. And it's Band-Aid surgery. They go in, they can see where they're going. They zap the tissue, is literally vaporized immediately. Post-operatively, they just put a Band-Aid on it. You get over the insult, which may take a day or two, but basically, the condition is much improved off table. As soon as you get off the surgical table, you have improvement, and it's immediate, and it does minimal damage to your hands, and the heal time is minimal as well. But you have to go to a doctor office that, one, has that technology, two, knows how to do that procedure. If they've only been trained how to do it the old school way, that's the only thing they're going to offer you. So if they do, then or if they don't, you tell them you want to refer to somebody who does it that way. You want a minimally invasive procedure for your carpal tunnel syndrome. Okay, great question, Bob. Okay, I've been on Ozempic for a year and have lost only 25 pounds. I want to lose 20 to 25 more. Should I switch to Monero? Ronnie, that is a good question. Monero is a more potent molecule that goes to two receptors. These are both classes of drugs and what's called a GLP-1 antagonist inhibitors, GLP-1 inhibitors. The two products that are available, there are three: Ozempic, Wegovy, which is really the same medication made by the same company, but just named one versus the other. The Wegovy has only the weight loss indication. Ozempic is only indications for diabetes, but you also lose weight when taking it. It's the one that's taken off. Everybody knows the name Ozempic, but Monero, just a newer, better version. I think that it's more efficient. It does make you lose weight, but you have another option as well. The maximum dose for the Ozempic has been traditionally 1 milligram, and that's the dose that people would take for a one shot, one time per week. They have doubled that. There's a 2 milligram maximum dose now. So for people that are plateauing or only lost a small amount of weight, like you, 25 pounds, then that may be exactly what you need, since you're already familiar with the Ozempic. I'm presuming if you've been on it for a year, your insurance has to be covering it, because if they weren't, it would be costing you $1,600 per month. So you might be able to just get your physician to increase the dose to 2 milligrams, and you may accomplish the objective that you want. But also, it depends. Do you need to lose more than 25 pounds? If you're 300 pounds, you've lost 20 pounds, that's 1 point. If you're 130 pounds and you lost 20 pounds, you don't need to lose anymore, so your body is just stabilizing. So that is the rest of the story that we have to know about you, Ronnie. But other than that, again, I don't think you'd have any problems no matter what your size is. going from Ozempic 1 milligram to 2 milligrams, because that will defeat the plateau effect that some people have after they've been on it for a while, and increase and enhance your weight loss. Or you just introduce your body to its new best friend, the Monero. And that's Mounjaro. Mounjaro. Okay, final question, Havlik. Let's get to it. Anita Suba, I'm suffering from shingles and I'm taking an 800 milligram acyclovir 5 times a day. Will this high dosage damage my kidneys or liver? Should not, Anita. And you're only going to be on it for a short period of time, but that is the dose that's necessary. You have, I guess you could say, a small window and opportunity to prevent this from becoming a chronic problem and you having recurrent shingles. That's why it requires a high dose. It really eradicates the virus, stops the virus replication, and you can do that but acyclovir is probably not the best molecule that's out there. Valcyclovir and famciclovir are the two best. That's Valtrex and Famvir. Acyclovir, the 5 times a day, you can take the Valtrex 1,000 milligrams once or twice a day. I think twice a day would be the dose. And one, it will cut down on your pill burden, and two, probably be more effective. So, but if you're already into the acyclovir, if you're more than 5 days in, you kind of committed at this point, and you're only going to take it for 10 no more than 20 days anyway. So in doing so, but the answer to your question is that it should not damage your kidneys or your liver. Just make sure that you're drinking plenty of fluids and avoiding alcohol during this period of time. Hopefully you'll get over the shingles. Check in at our next Facebook Live and let us know how you're doing. Okay. All right. So that was our final question, Havlik. We're going to close it out right here, right now. Let's go to our theme song. Okay, it's not doing it. I can't get it. So thank you for joining us tonight for tonight's Facebook Live program. We hope that you were on the gram as well, and you have found that this was a good use of your time, that you have gotten great healthcare information, and that you are sharing this information with your friends. Be the medical ambassador, the medical advocate in your group. When you and your friends get together, talk about more than what's going on, on television and your favorite programs, and have you watched Queen Charlotte and what's going on the Real Housewives or whatever city you're living in. Talk about health. Talk about things that you have learned and say, did you know about this product? Did you know that there's a new treatment for heavy bleeding for uterine fibroids? You need to tune in and tell all your friends. Tune in to Dr. MJ Collier's Facebook Live on Wednesdays at 6:30 Eastern Standard Time. Why? Because your health is important. Thank you so much. We'll see you next time.